Everybody, welcome you. Today we are going to discuss cancer treatment. How many methods to treat the cancers? One of them is chemotherapy, and the second is radiotherapy, and third is cancer treatment with medicines and also surgery. They are the methods. You also know that October month is recognized as a breast cancers, but we are going to discuss overall treatment process of cancer. It's a very dangerous disease now in whole world, but the thing is good, the treatment is available, but the stages is categorized first, second, third and fourth. First, second is easily treatmentable, and third is also, but the fourth is very serious. Hormone therapy, surgery, chemotherapy, radiotherapy, targeted anti-cancer therapy, immunotherapy. No, put them in the order that they were introduced. First of all, we are going to discuss about the surgery. What is surgery used for that? A reason behind it for mine discussion about the cancers. I also know and to support a cancer patients, and we are supporting to the cancer patients. Therefore, first of all, surgery can be used make a diagnosis biopsy to see the type of cancer and how quickly it might grow. Great. Fine needle aspiration FNA test on the laboratory. Another is core biopsy, incisional biopsy, excisional biopsy. They are the two further categorized types of core biopsy. Can be assisted by the endoscopy, ultrasound, and CT guided. Important is CT guided. Stage cancer size. They provide you about the after these tests. You can also listen. I tell you about these tests. Give you information about the stage cancer, size, extent, and location of cancer. Treat cancer if there is a simple if there is a complete resection clear margins and it has not chapped, it can be curative treatment. Regional lymph nodes can also be removed to look for cancer separate. Then cancer growth remove the some but not all of cancers. Done when the complete resections is not possible, as it could cause too much damage to nearby the organs and tissues. Reconstruct part of the body affected by the cancer or its treatment. Prevent and reduce the occurrence in the high familial risk of cancer. Control the symptoms or increase the quality of life, that is, tumor pressing on nerves or other organ causing a pain, orthopedic surgery to support the bone affected by the meta, remove the obstructions ball blocked by the cancer growth, type of cancer, stage and location, that surgery, aim of treatment, general health, fitness of fitness for anesthetic, managing the post or of the cooperative rehabilitations can be combined with each others. This biopsy and FNAC test also support for the further treatment for doctor of cancer patients to treat them. Another methods radiotherapy is local treatment targeted to the specific sites in the body where the cancer part existing. It uses for ionizing radiation to damage the DNA part of cancer. Okay, and this is the process types of radiations: extremely low frequency radio wave and microwaves. That's all about the radiotherapy. Radiation that is able to disrupt the chemical structure of the material that is passes through the molecule or basic building block for all living and non-living things. Made of atoms, ionizing the radiation excites cells molecule and changes their atomic and molecular structure. These changes cause damage to the cell. The target of damage with radiotherapy is the cell's DNA. Cells that are dividing are more prone to damage for radiotherapy. How is it given? That's very important. External beams, linear accelerator, treatment delivered by the therapy radiographs. Radiation is created by the machine of radiotherapy. No radiation present when the machine switched off. Patient does not become radioactive. Brachytherapy, sealed and unsealed sources. Sealed sources, radiation is located in the sources. Unsealed sources, patient is temporarily radioactive. Linear accelerator machine, that is the machine where the adjustment by the radiotherapy doctor and technicians and also patient is under the machines for radiotherapy. The aim of radiotherapy treatment maximize the damage to the cancer cells while minimizing the damage to the healthy cells. How is this achieved? Spelting the dust into the small pot and giving a little each day. This is called fractionations. Increases the chances of catching cancer cells when they are sensitive to radiotherapy. Give normal cell a chance to recover from sublethal damage. They are picturized here. You also know that. How is this achieved? Control for treatment field and planning simulations, accurate setting up and deliver the treatment. The You're also watching here some picture of the technicians. They are settings for the radiations and the result of radiations and the cells of the cancer which are particularly important to destroy by using the radiotherapy machines. Careful positionings very important for the certain area of the cancer cells fixed and targetized by the technicians and doctors under the particular angles of radiation by the radiotherapy machines. Side effect of radiotherapy: severity related to the dose the patient receives. Side effects are classified as acute and chronic, local and the systematic. When do the side effect occurs? Start to appear in the first 2 weeks, increase in the severity over the course of treatment, peak 2 weeks after the treatment has ended. Effects experienced by all the patient: fatigue and skin reactions like allergic forms and some others. Other side of effects or the site specific: support during the treatment, the time for support, deciding to have treatment, the first treatment, the treatment experience, arduous, requires patience, can be embarrassing, inconvenience, traveling, delays, waiting. Side effects: consequences of diagnosis, uncertain and outcomes. Radiotherapy safety: ionizing radiation, X-rays, danger radiation area. The healthy patient is not allowed to enter in that room where the machine is fixed for the safety. Use of ionizing radiation very carefully controlled and regulated. measure in the place to prevent exposure to radiations. Staff are monitored if they are likely to be exposed on a regular basis. Radiation protections safety principles like that signs of flock and hand up, raise up. Chemotherapy. How does chemotherapy work? Chemotherapy is a systematic treatment. This means it can be affect all the cells in the body. Chemotherapy drugs stop cells from the dividing or make it difficult for them to do so. Different chemotherapy drugs do this in the different ways. Many work at a particular point when the cell is dividing. This is the often referred to as the cell cycle. In this picture is very clear. You can see G2 phase and mitosis, multiplication of cells, cell cycle arrest process in the case of chemotherapy. How does the chemotherapy work? Some drugs work at a specific part of the cell cycle. Other can work at any point. Action includes stopping cell division, M-phase, by fusing the old and new cells together, preventing the products needed make the new DNA from getting to where they need to be, directly damaging DNA. Aim of chemotherapy maximize the damage to the cancer cells while the minimizing the damage to healthy cells, getting it just right. How is this achieved? Giving combination of drugs increase the cancer cells kill. If the more than one type of drug is given, they attack in the different ways. Giving drugs with the different side effects, meaning you can get more impact and fewer side effects. How is this once again achieved? Cycle of administration, giving a small amount each time increases the chance of catching cells when they are sensitive to chemotherapy, allows healthy cells to appear. Side effects. Incidence and occurrence of the side effects is the drug and dose related. It is essential to know the regime specific effects. Bone marrow dysplasions, infections, neutropenia, bruisings, bleedings, low platelets, red blood cells, anemia, nausea and vomiting, hematogenic potentials, fatigue, sore mouth, hair loss, altered bowel habits. Hormonal therapy is the type of cancer treatment. A hormone is a chemical messenger. It is produced in one part of the body and affects cells in another part. Example of the hormones include the insulin, steroids, and thyroxines. The main hormone involved in the cancers and cancer treatment are estrogen and testosterone and progesterone. Hormone therapy. Some cancer are hormone department. This means they use hormone to help them divide and survive. Prostate and breast cancer can be hormone dependent. Tests need to be carried out for each patient to identify if it is hormone dependent. If it is, then hormone treatment can be started. This can also be called endocrine therapy. Types of hormonal therapy. Hormone treatments work by blocking and the pathway through which the hormone get to the cancers. So they work in the one of two ways: stopping or lowering the section of hormone block the receptors on the cancers so the hormone can not get to it. This can slow the growth, shrink the cancer for the time, not a cure, but can be very effective over a long period of time. How do hormone therapy works? surgically removal of the organs that produces the hormones. Like that's analogous copy the hormone and fool the body into thinking it doesn't not need to make and release anymore. Antino antagonists sit on the receptor and stop the hormone from getting to the cancers. Hormone releasing the blockers stop the organ that usually produce the hormone from making and releasing it. Side effect: heart flushes, reduce the libido, impotence, osteoporosis, weak organs, fatigue. Targeted therapies, new treatment in the cancer therapy, number and use are increasing. Is it the new frontiers? Traditional chemotherapy, targeted therapy, working together to increase the effectiveness. How do they work? They work in the lots of different ways. The slow or stop tumor growth. They can put up the barriers to the sign signaling pathways the causing the cancer cell division, prevent the formation of tumors, blood vessels, stop the production of growth factors and enzymes that tell the cells to divide, alert the immune system to the cancer presence so it can be targeted. When are they used? They are most of the time used when a cancer overexpresses a particular growth factor. Tests are done to see if the growth factor is being produced by the cancer. If it is, then the targeted immunotherapy treatment is given. For example, some breast cancer overexpress a growth factor called HER and PRs. Like HER2, tests are done to assess the HER2 status to see if it is overexpressed. It is then they may receive receptions, reception, and recipients as a part of their treatment. Example of targeted therapy: they most of the times end in the letter MIB, MAB. Like, thank you.